All right, so now we're going to talk about reproductive health in younger and middle-aged women. So think about from age 18 till 50 or so. The needs of young middle-aged women, a lot of times focus around contraception or childbearing. So when we have a whole lecture on contraception and fertility management. One of the things that we might be doing as nurses is helping women figure out what is the best option for them, what contraceptive option is best for them. We also look at screening for cancers, STIs, and other problems. Pap smears should be done every 3 years from 21 to 65, unless that person has increased risk. From 30 to 65, it can be every 5 years if they have a negative Pap and a negative HPV. We learned several years ago that HPV, which is a usually sexually transmitted virus, is responsible for most cervical cancers. HPV infection is really, really high in the US. Most of the time it is not symptomatic, but it can cause genital warts, and it can also cause cervical and penile cancers. Women should have a clinical breast exam every 3 years. Also teach people how to know their breast and to report any changes if they notice a new lump, things like that. A mammogram should be done every 1 to 2 years from 40 to 49, yearly from either 40 or 50 to 74, and then every 2 years, or discuss it with their provider after 75. So the recommendations for these screenings vary. That's why there are some discrepancies. I'm not going to test you on the discrepancies. If, for example, if there's a question about someone who's 40, I'm not going to say, should they have a mammogram every year or every 2 years, because it could be either depending on the guidelines that are being followed. So don't stress about those. Just be aware that there are some discrepancies and have a general idea of when and how frequent those things should be. Higher risk women for breast cancer should start earlier and should have annual mammograms. Pregnancy care, we're going to have a whole unit on that, so don't stress about that yet. Some common problems for women in those childbearing and child raising years: vaginal and urinary tract infections, menstrual variations or problems, obesity, sexual relationship issues, pregnancy, relationship violence. You'll see that it stays steady throughout all of these. Women frequently have competing responsibilities and often neglect their health during these years because they're busy. They're caring for kids, they're caring for older family members, they're caring for everyone except themselves. And it's very, very common for women to neglect their own health. And then those things kind of come back to haunt them later on. So we want to encourage women to care for their own health. Also remember that during these childbearing and child raising years is when a lot of women are going to face they're going to run into disparities in the availability of healthcare or in the affordability of healthcare. So be aware of the effect that societal factors are going to have on health as well. Okay, the next video will be very short because we don't talk as much about aging in this unit. You get into that more next year. So we're going to talk about menopausal and postmenopausal women in the next video, but it'll be short.